It's known that reduction in the level of circulating stem cells and endothelial progenitor cells predicts development or progression of chronic complications in patients with type 2 diabetes. It's also known that a treatment with SGLT2 inhibitors is associated with an improvement in cardiovascular and renal outcomes. So we decided to test whether treatment with SGLT2 inhibitors affects the levels of circulating stem cells and endothelial progenitor cells. For these aims, we enrolled 31 patients with type 2 diabetes that were randomized to receive dapagliflozin or placebo for 12 weeks. Circulating stem cells and endothelial progenitor cells were measured by flow cytometry at baseline after the 12 weeks of treatment and again after an open label extension period. Also, circulating stem cells and endothelial progenitor cells were also quantified at baseline and after 12 weeks of an open label treatment with empagliflozin. After 12 weeks, circulating stem cells non-significant decline in the dapagliflozin group in the blue line and remain stable in the placebo group, red line, but the change from baseline was not significant different between the two groups. Endothelial progenitor cells non-significantly decline in the dapagliflozin group and non-significantly increase in the placebo group. After an open label extension period of 74 weeks, we can see in figure 3 circulating stem cells remain stable over the time in both groups, while endothelial progenitor cells significantly increase in the dapagliflozin group during the randomized or the open label extension period. In all patients, irrespective of the treatment, endothelial progenitor cells significantly increase from baseline to the end of observation, concomitantly with the improvement in glycated hemoglobin. In the figure 5, we can see how in a cohort of 15 patients who receive an open label treatment with empagliflozin for 12 weeks, circulating stem cells non-significantly decline, whereas endothelial progenitor cells remain stable. So we can conclude that during 12 weeks of treatment, SGLT2 inhibitors do not significantly increase circulating stem cells and endothelial progenitor cells. Thus, cardiovascular protection by SGLT2 inhibitors may not directly involve these cells. Also, an improvement in glucose control over 1 year is associated with a significant increase in endothelial progenitor cells levels. Thank you.
Thank you very much.